Hey everyone, it's been a while since I did a video blog and I'm trying to catch up. Life has been extremely busy and chaotic lately. There's a lot going on. Our CF walk just happened, and so far my team has raised $5,400 towards our goal of $6,000 this year. And our next event coming up is a crab feast at Jimmy's Seafood in Baltimore in August. I'll actually post the details about that in the comments in case you Marylanders are interested. Anyway, and our mission trip for church is coming up in July. I actually got cleared by my CF doctors to go on that. I'm going to do a travel blog soon about traveling with CF and all that good stuff. But today, I kind of want to focus on a very highly debated and sensitive topic among some CFers, and it's why we can't hang out with each other. And I know there are CF patients that hang out with each other, and I know that there are CF patients that date each other, and in my personal opinion, y'all motherfuckers are crazy. Just saying. I love all of you, but you're fucking crazy. Seriously. It's just not a good idea. There's infection control policies in place for a reason, and I'm going to get into that. So why we can't hang out with each other is because we culture in our lungs, as CF patients, different strains and different types of deadly bacteria. It's what causes our lung infections. It's what kills us, basically, and or killing us, I should say. Kind of both, I guess. And we can transfer that bacteria between us with contact on our hands, touching something that another CF patient touched, coughing, and when you cough and you have a lot of mucus in your lungs like some CF patients do, and sometimes it comes out of nowhere and you don't get a chance to cover your face or your mouth, you're coughing that mucus or little pieces of that mucus everywhere. So you cough on, even if you cough on your hand and you touch something else and another CF patient touches that, we can pick up that bacteria. We risk ourselves every time we walk into a doctor's office or a hospital, for that matter, where other CF patients are, because you never know who's in clinic that day. You never know who's in the hospital that day, even if it's not their clinic appointment that day. And of course, in general, let me generalize this. You're at risk everywhere you go. But we can't live in a bubble as CF patients. Most people think we should. I think a lot of people, well, I shouldn't say most, a lot of people think we should live in a bubble, and I've never lived in a bubble my entire life, nor will I ever live in a bubble. I'm not a germaphobe. The only time I ever really kind of became, what's the word I'm looking for, adamant about hand sanitizer and stuff like that is after I cultured MRSA in my lungs. And yeah, that was scary, because when you think MRSA, you think, the skin infection that can kill you and it's, eats your skin away and all that shit. It's different in your lungs, actually, and it's pretty common in CF patients. However, I was told by my CF doctor that if I had a cut or a scrape or an open wound or something, and I coughed on it, it could turn in to that strain of MRSA that infects your skin and all that stuff. Vancomycin is what they used to treat it when I got it back in 2009. I don't even know where I got it or how I got it. All I know is I had it, and I had a nervous breakdown on the phone, oh my God, I'm gonna die, But anyway, I was really sick back then. And, but anyway, so I'm rambling about that. The different types of bacteria, there's a billion types of bacteria that, on this planet. Some of the common ones that I'm going to name off in CF patients are, like I said, MRSA, Pseudomonas, which I do culture, I think, 3 or 4 different strains of Pseudomonas, which is I think probably the most common bacteria in CF patients. That's at least the main one. And there's I'm going to abbreviate some of these because the words are 5 million letters long. Stenobacteria, like I said, it's spelled like a word like this big, but they call it, the abbreviated is steno. There's Mycobacterium, which is in the tuberculosis family. It's common in Florida waterways. I was just learning about this. I asked people on my CF group to kind of say, you know, what do you culture, so I can kind of get an idea of maybe some other ones that are out there that I wasn't aware of, and I learned something, especially about the Mycobacterium. There is Beecipacia, which is like, we'll just call it the king of all deadly bacteria for CF patients, because those who culture Beecipacia, at least in my clinic in Hopkins, which I still, you know, think is the best hospital on the planet, don't even have clinic on the same day as everybody else. And those patients are on a different floor when they're in the hospital. That's how messed up that shit is. That's what actually shut down all of the camps back in the 80s that us CF patients actually used to get together all the time for camp. And we were killing each other, flat out. We were killing each other. Or making each other even more sick. And they shut the camps down when they realized that we were transferring bacteria between us and creating these super bugs that were super antibiotic resistant and making us hella sick, you know, if not killing us. So yeah, like I was saying, like I said, I listed off a bunch of different ones: the steno, the Mycobacterium. There's a fungi called Aspergillus. That's the one that affects CF patients a lot. I only culture Pseudomonas currently, and like I said, I cultured MRSA one time and I beat it, thank God. The only thing that sucked about that was I'm allergic to the vancomycin. I get the, it's called red man syndrome. My skin gets really red and hot. So I was a Benadryl zombie for like the 3 weeks that I was on it. It sucked. But anyway, so like I was saying, this is a highly debated topic between CF patients, and I know some of you are probably going to be really pissed off at me after I say this, and you know, some things I say, but I don't really care, because you know, you all know I speak my mind, about being crazy for hanging out with each other, you know, or dating each other. Y'all nuts. I mean, if you have a sister or a brother that has CF and you're in the same household, that's kind of unavoidable, you know, and I get it. You want to hang out with somebody that has the same thing as you. You want to identify, because there's like a lot of social outcasts with CF because we can't hang out with each other. And I use social media to keep in contact with a lot of CF patients, obviously. And I've gotten in this heated debate and arguments so many times. And I just don't even really debate it anymore, because I don't need the stress or aggravation in my life, because, you know, everybody has a different opinion. Everybody's entitled to their own opinion. I think y'all that hang out with each other, again, are fucking nuts. But anyway, it's just not smart. It's not smart. I noticed, I'm going to point this out, and I'm going to point out something that has been going around, and I noticed something because I talked to a few of these people. When the Salty Girls thing came out, you know, when they did the shoot with CF patients, and, you know, the salty women strong for CF, and, you know, somebody, a few of those people that hung out with each other and did the shoot with each other and were hugging each other and stuff like that were in the hospital within the next few weeks, sick. Did you think about that for a hot minute? Think about that. Let that sink in for a minute. Let it sink in. You were hanging out with each other. You don't know what each other cultures, and even if you do culture the same thing, such as Pseudomonas, there's different strains of it. You could have created some super bug in your lungs, and you fucked your ass up and landed in the hospital by hanging out with each other. I love you, but again, you're crazy. So anyway, that's kind of like my random, I know I just kind of went on a rant here about, sorry about my language, everybody, I really am, but it aggravates me, because I understand fully wanting to hang out with somebody that you can identify with. I've lived it. I have CF. I know all about it. but it's not worth the risk to your health. And if you want to knock a few years off your life by hanging out with somebody that you can Skype with, Facebook with, talk on the phone, Snapchat, we have 5 million different ways to communicate. And if you want to knock a few years off your life by doing that, power to the people. More power to you. I just can't do it. And I will never do it. I get nervous in CF clinic when it's a busy day. And like today, I had CF clinic today. And there was a few other CF patients around. Yeah, we all have masks, and everything. But I sanitize the shit out of my hands because I don't know what they're touching. And I don't know what they got. And I don't want it. I'm trying to stay healthy. I blew 92% today. It's the highest I've been in 9 months because I've been so busy and I wear myself out and I worry about everybody else instead of myself. And I am happy because I'm going to Honduras. And I'm not trying to have that fucked up by any means. But anyway, yeah, kind of end rant there, huh? So that's why we can't hang out with each other. That's why there's such strict infection control policies. Especially, I know each place is different. Hopkins, I know, has one of the strictest infection control policies. And that's because they're smart and they know what they're doing. And, for the CF walk, it's all out, and CF events, it's all outdoors now. That's the only way more than one CF patient can be there. The CF Foundation put it in place those rules, and they're smart for doing it. They're absolutely 100% right for doing it. And I've seen a few people knock the CF Foundation for that, and y'all are wrong. They are just trying to protect us and keep us healthy and safe as possible. And if you want to hang out with somebody with CF, do it on your own time. Don't do it on theirs. But anyway, so outdoors events, as much of us can be there, we got to keep a 6-foot radius between us and other CF patients at outdoor events. And if you're at an outdoor event that other CF patients are at, and it's a CF event, and they got, let me give you an example. They got lays for us to wear or pins or something. Put that shit on, because not all of us know each other. Not all of us know faces. Put that shit on. We want to know who you are because I want to stay away from you. And so does everybody else, for that matter. Not that we, not in a mean way, just I want to stay healthy and I'm trying to abide by the rules. There are people around here that, I'm not really one that, is for rules, but those are rules I will follow. I know some of you don't put it on because I've seen it, because I know some of you and I've seen you not put that shit on. Put it on and identify yourself to those who may not know who you are. Anyway, that's kind of my other rant about that. And keep that 6-foot radius. Especially in, on clinic days and whatever. I stood on the other side of the room today. I wasn't nowhere near them motherfuckers. I'm getting kind of worked up, can you tell? And I'm sitting at 13 minutes right now. So I probably took up much of your time and got the gist across of why we can't hang out with each other. We make each other sick and we can kill each other. Point blank. It's that simple. Peace out for now. Have a good day. I'm so glad it's summer, but this heat is killing me. Catch you next time around for the travel blog. See ya.